Greetings and good Friday morning to you. You are listening to Community Heartbeat presented by Outreach Community Health Center. It's not just a show, it is a movement dedicated to bringing our community together through wellness, keeping your heart pumping with positivity. Happy last day of Black History Month.
Yeah.
Happy Heart Month. We were in here just cracking up. Laughter is good for the heart. I'm convinced. You gotta find the joy in here, though, no matter what it what it looks like. I want to jump on that topic a little later. We're just gonna talk about the animal kingdom and if they have some of the same separations that we do. They have conversations amongst themselves together. So we'll chat about that. Hopefully make you crack a smile.
And reservations too, like
right, like
and you know what? I think they do, because I'm gonna tell you just right quickly.
Yeah.
I'm standing here in the window and I see these two dogs. They running loose out here. Well, one of them run out across Capitol. The other one was right behind him. When that first one got hit, he
said, right, like, yeah, buddy.
I'm like, you all right, dog?
Yeah. But well, they say crows actually remember your face.
Remember you, yeah.
And if you give them food, they'll start to bring you like coins and little gifts.
Oh, really?
So
but if you no, seriously, but if you make them mad,
they remember your face.
Remember you and attack you every time they see you.
Yeah,
that's true.
Like on site.
Yeah,
on site.
That's true. I'm not cruel to animals.
This is good. Like be kind. Be kind to animals. Be kind to your fellow.
Looked at the other one. He
said,
got himself together. He went on down the street with him. He was like, "Man, I tried to tell you, don't go."
No, he went past him like, "See you at the crossroads. You gonna be lonely."
Like I told you. Remember, I told you. Follow me. Stay close. Stay close.
Yeah, that was amusing to me.
They know
that he stopped just like in his tracks, like, uh-oh.
Right.
Like something right, yeah. Like, oh man, he hit the ground hard, Jack.
Wow. But wait, they both got up and walked off. Oh, he was yelling at him the whole way home.
I told you that. Man, don't you know you on Capitol, man?
Can't be doing that. That's suburban behavior. You down here, you better cut it. But act like you know. Act like you know. I love it. So again, find some joy, find some laughter for your heart. This is the last day of Heart Month, and we've had a couple things going on at Outreach. So let me give you the quick rundown of what's going on. Immunizations, vaccinations, still a thing. So y'all got me laughing in here. My eyes all watering away.
That was you started that this morning.
I know. I thought about the little dog. We got immunizations, vaccinations going on at Outreach Community Health Center. It's not too late. Listen, I feel like COVID is coming back. I've run into a couple people that have just had COVID again. So look, run into them like, oh, you sniffling on the Zoom or doing the thing. So we got to take care of ourselves. Get your immunizations. I'm not even gonna look at you when I say that right out, but I want you to know those are important. We're gonna talk about the measles outbreak in Texas. Like measles is back. Measles has a vaccination, so we shouldn't be going through that. So those are still going, and I believe we'll do those through the end of March.
Typically, if you have it as a child, you will not get it as an adult.
See, and why do we have to have it as a child though?
Because is that where they say if you had the measles, or is
or
that
chicken
where
pox
shingles comes from?
That's chicken pox. I do know that.
Chicken pox is where the shingles come in.
Yep. Okay. Yep. And I only know that because I've never had chicken pox. And I wanted it as a kid. I'm like, you should rub up on me.
It can be rather dangerous for you at your age.
It can. Hey.
Well, I don't mean in a sense like that. I mean just as an adult.
Because I'm a lady of a certain age.
No. I mean adults can have a real bad bout with chicken pox.
This is true. So no, I've been vaxxed up for that. As soon maybe late teens. No. Late, maybe 8-9 years old. I think they came out with the vaccine. But I get that when it's due. But vaccinations, get them. Like,
is that the one they used to hit you with that gun with?
All I know is it leaves a mark. It does leave a mark if you get it. Yeah, as a kid. Well, we get the baby's ear pierced. We need to stop it. it. The same babies that get their ear pierced get that vaccination.
Baby don't know it hurt.
Man, until after you hit them, and then
they don't last long as we do with the crying.
I don't know. I will say this: when my daughter got her shots, she and she's always been a quiet, reserved kid, but she just looked at me like, Why would you? And then I think she
to
had to have two at the time. And so the second time she looked, she did not cry, but she gave a look like, yeah, we probably won't be coming here
like,
again.
Mom, I need to talk to you when we leave.
Wait till we get in the car.
Anyway.
Wait till we get in the car. That's the way she looked. But it's important to get our babies vaccinated. The things that are easy to control, let's control that. They're gonna have knocks from the cradle to the grave, and we're gonna talk about that. I was in Madison yesterday for Advocacy Day, Black Advocacy Day. We're talking health disparities and what needs to come down to the city. We're talking about federal funding and how that's doled out to the state. So we'll get into that a little bit too. But yeah, the babies, I feel like, also know. They just don't have the language to communicate. So it's kind of like that the animal kingdom can communicate. Because I feel like my daughter called me some things in her mind. And she probably didn't even know what she was trying to say, but she felt it. She felt it. Like, this hurts me. But, you know, she's been good. So I can't complain about that. March 6th, we have car seat safety checks. So if you are new mom, old mom, couple kids, you know, they make these new car seats now that probably fly you to the moon if you let it. Come and get your car seat checked out to make sure that your babies are safe. If we're talking about the things that have changed in the country, you know, we used to be able to bop in the back seat and jump around and do all that until we got yelled at to put our seatbelt on. But now your kids should be in a car seat until they're about 12. So
12
until 12. Yep.
Cut that out.
I'm serious. It's like a little.
You're not gonna get little Johnny to sit in no car.
Okay,
seat.
Watch this. They make nice leather ones though. Like, they make nice ones that look like your car seat.
Wait, so you said 12 years old?
12 years old. Now, if I have to solve for the differences in different, how do I want to say, how puberty hits different race groups and age groups and that. So generally speaking, I don't want to hear y'all call me with negativity. Generally speaking, African American youth do range taller.
And wider.
And a little bit wider, but that's food choices.
You're gonna have a 6'8", 12-year-old in this little seat. Mad at
just feet arms crossed. I want to see.
I don't even want to go. You gonna make me ride in this thing? You gonna make me. My friends see me.
You could get a nice one, but here's the thing. So what they're measuring is when your car hits an impact, those impact zones, if you will, hit in certain places. So if you don't want your head to be, you know, dislodged from your body, you might want to get be at the right height. Right? You might want to be situated properly. It's kind of like when you see the people who ride with their seats real low. If you were to get into an accident, like, your whole body will go through your dashboard. And it's a little morbid to say, but it's safety. So what they're trying to do is boost the kids up to be the right height so that if you do impact, your kids are still safe. You walk away with maybe broken bones and not without maybe a head, which is important. You're going to actually need that. So really? I say you will.
But I do know that
you will. You're going to need that.
Technology, I guess, constantly changes is the word I'll use to the extent that, you know, your baby, like my granddaughter, for instance, she just turned 2. But that car seat that she came home in, she can still fit in it. But it is time for her to have a whole different car seat now.
So we probably need to see you on the 6th. We need to be able to look at what you got. Now they make them now where you can buy one and then that one converts, right? And converts into this booster seat. So it may have like
so she'll be able to use this till she 15.
Yeah. Okay, 12 was what I said. you like, so now you at the DMV and you're like, I need to move my car seat from the back to the front, right? Y'all are a mess. Now, what I think, okay, so if we look at it from a business standpoint, shouldn't that be an add-on? Like, because if we made a Gucci booster seat, like, the people will be on to that. So I feel like you're right. Make it luxury. So bring your car seat. Make sure your babies are good. If you're a car manufacturer, work for one. we're putting you on game. Make a car seat that's luxurious, that blends in with the seat, and let's get this money and let's get these folks safe. Also coming up, we are at the gathering on March 15th. So when we talk women's health, we're gonna have some fun. We got some giveaways for that. So we'll be there all day at the gathering Potawatomi on March 15th. So come out, say hey. We're doing blood pressure checks. So that's the connection. Sharing that out now because it's Heart Month. We talked about the shrimp fried rice, the chicken fried rice, the Benihana steak. That's coming on March 19th. So I want your face in the place. Individual tickets are still available. You can go to the website ochc-milw.org for tickets and for more information. I think they might still even be accepting sponsorships. So I'm going to log in and see where we're at with that. But that is Wednesday, March 19th. Come through, say hey to our crew that's been working so hard for you. And then on August 9th. Now, Debo, did you put this in your phone already? August 9th. Oh, see. He went to go get his phone. He went to go get his phone. Did you put the health fair in your phone? Do you have that locked in? You doing it right now? That's what I thought. That's what I was, because he's already ahead of the game. I like that. August 9th, Saturday, from 10 a.m. to 3 p.m., we have the Community Health and Resource Fair. Listen, this year, we're already getting started. We have 5 vendors secured. So this thing is going to sell out. I'm telling you now. You want to be a part of it, call us, go to the website, and register for your booth. That's the Community Health and Resource Fair on August 9th. It's going to be a party. And if I'm not mistaken, y'all will be there. So we're broadcasting live from the health fair. So make sure you stay tuned for that. It will be a time. So I mentioned I was in Madison yesterday. The women of Alpha Kappa Alpha Sorority Incorporated were at the Capitol, but so were so many of our advocacy. What do I want to call them? Advocates. That's what they are. Our community partners, collaborators, the Divine Nine. So salute to everybody that's doing the work of their sororities and fraternities. But on the health side, so with this show, obviously, is represented by Outreach Community Health Centers. We were there talking about Black maternal health. Now, we had Dr. Hillary Evans on the show in January. We were talking about babies and the health of babies. But as we talked about that, Senator LaTanya Johnson, shout out to Senator Johnson, she put together this whole packet about the health disparities that are affecting us right here. And not only that, giving us action items. So I did reach out, asked her if she and her team would be willing to coordinate some time to appear on the show. So that's forthcoming. But thank you, Senator Johnson. Representative Sheila Stubbs, listen, I hadn't really delved deep into Representative Sheila Stubbs because she represents parts of Madison. But my sister is cold. And when I say that, her approach to getting legislation pushed through that will make us healthier, she is relentless. And that's what we need. We need more people that are absolutely relentless of making us healthier. So some of the things we went over, the social determinants of health, right? It's the education, it's the access to education and the quality of education. It's economic stability. It's social and community context. It's what your neighborhoods look like. And our part of that entire puzzle is we are the healthcare access and quality. So those things make up how healthy you are. So if you think about it, what kind of education, what kind of schools do we have? What is MPS doing? That determines how healthy you will be. Economic stability, right? How much money is being funneled into our community. That has a direct effect on your health, like directly. Do you have outlets for your friends, for your family? That social and community context is huge. Then what does your neighborhood look like? Do you have abandoned buildings everywhere? Do you have lead paint exposure? Do you have lead laterals coming up into your house? all of these things determine how healthy you are. And we'll get into why it's important to legislate on those, why it's important to advocate on those. But for us, it's the healthcare piece. Our healthcare clinic, pharmacy, dental, all of those, they're safety nets. They're safety nets for keeping us keeping us alive and well. So it was a great time, great information shared. And we'll review a little bit more over that throughout the show. We'll go through the packet that she gave us. Again, sis gave us homework, and I love that. Because listen, y'all, we are in a time where it's important to get mad. It's important to get upset. I'm 100% believing in that. But once you get upset and you get angry, get moving and start moving on the things that are making you upset. So if you feel that your neighborhoods are not what you want them to be, get mad and call your legislators. Get mad and vote the people into office that are actually doing the work and have the track record. Vote for entrepreneurship, businesses to come into your community to create that economic stability. Vote, advocate, support, right? So sometimes you can't make it. What's the saying right out that, you need people at every part of the struggle. Somebody had to keep the kids, somebody had to cook the food. Everybody didn't go out to march, but everybody had a part, right? So if we look at these determinants of health, again, I'm going to push you, Milwaukee, to decide where your part in building our community is. For me, that's healthcare access and quality. That's making sure I'm sharing out the knowledge that I have, the knowledge that we have at Outreach, to just make us healthier, make us better. So again, shout out to Senator LaTanya Johnson and Representative Sheila Stubbs. Just brilliant women that are actually doing the work and are relentless in that work. So salute to you. One of the pieces that Senator Johnson brought up was housing security. And so for those of you that listen to the show, you've researched Outreach, you know that we have a homeless or unhoused population component where we're going out, we're meeting people where they are, we're providing them with food, we're providing them with clothing, and then we're providing them with the services to get them shelter. But she gave us the numbers. So that's why I'm loving my good sis, because she put the actual numbers behind it. So one of the things she gave us was in 2024, Wisconsin had 5,037 people sleeping in places that were not meant for human habitation. And that was up from 4861. So 4,861 people in 2023. What that means is more people were sleeping out on the street. So I'm charging us together. Before we go out, we celebrate, we spend money. How are we helping? That's what I want to know. How are we helping? We had 18,455 students, Wisconsin public schools, that lacked fixed, regular, and adequate nighttime residency. Our babies had nowhere to sleep. So on this show, I've talked about Marvin Gaye's lyrics and how that shed a light on what we got going on. I'm just going to say our music needs to reflect the times. Our advocacy needs to reflect the times. Our work has to reflect the times. So if I take this personally, me as a professional, part of my job is making sure that the marketing I'm sharing, the information that I'm sharing, can help house our population that are sleeping on the street. We got 5,000 of those. And that can make sure that our babies have a place to sleep. And that's 18,000 of them. So over the course of the show, we'll talk about how these social determinants come into play, what we need to be looking for, how we get better, because that's what we're here for. I do want you to talk back to me, though, today, Milwaukee. 414 444-5250. So we are heading to break, right? I think we got a break coming up. Okay, so when we come back, we will talk more social determinants of health. We do have a guest today that's going to be in talking about heart health, so I'll introduce him and we'll share more information. You are listening to Community Heartbeat presented by Outreach Community Health Centers. I am Ebony SsALI. Happy Friday. We will be right back.
Dr. Bob, whose real name was Hoyt Locke, embodied Say It Loud, I'm Black.
106.5 Milwaukee.
Welcome back. Good morning. You're listening to Community Heartbeat presented by Outreach Community Health Centers. I am EBONY. SsALI. We are talking heart health. We talked about laughter being good for the soul. Y'all, we be in here cutting up. Officially cutting up during the break, but I love it. It's good for my heart. We talked about a couple of the upcoming events that are happening at Outreach. Let me add two. Shame on me for not remembering these. On the 8th of March, we have the community baby shower that's going to be at Thrive On. So we got some of our team over there. They're pulling together to provide some resources for moms. And again, that just goes with the theme that we've been talking about, keeping our community healthy, keeping our community well. I'll chat a bit about a young doctor coming up. She's in med school now. We'll talk about her process and what she's finding in healthcare, and then what Outreach is doing to maybe overcome some of those things. So before the break, we were talking about housing security and people having a place to lay their head, how that's playing out in the state. So if you didn't catch me mention it earlier, Outreach Community Health Centers has a community services program that works with the unhoused population. Those are who are experiencing insecurity in their housing, just don't have a place to stay. We can get into the reasons for that. But I think one of the things that goes a little bit under the radar sometimes is we don't talk about the choice that people make to not stay in certain negative situations. So you really have to think about this. Some living conditions are so poor, some situations are so dire that people would rather live outside. So we have work to do from the aspect that we've got to figure out how to make those places safer, how to make those places more hospitable, how to make those places more disease-free, more safe in the terms of like lead poisoning. So if I'm forced to stay in a place that's poisoning my body slowly, I might make the decision to move around, right? And then I don't have that stable housing. So let's put our most brilliant minds on this. I feel like this is one of those instances where all it takes is a couple people with their minds focused on solutions to come up with solutions. So if you know somebody that's experiencing instability with their housing, if you know someone that's just not getting enough to eat every day, give Outreach a call, 414-727-6320. Schedule an appointment with our community services representatives and figure out how you can kind of get out of that loop or share those resources with someone to help them out. So one of the other things we talked about, let me flip through this packet again. Shout out to Senator LaTanya Johnson. I'm reading from this information. One of the things she shared with us that I had to write down because it rocked me almost to my core. When moms have new babies, right? So they're at the hospital, they deliver, they've got benefits that help them cover that birth. The postpartum period is considered the fourth trimester. So, you got women, they're pregnant, it's the first trimester, second trimester, baby's growing, baby is delivered in the third trimester. We have something called that fourth trimester, which is that time after the baby is born. Right now, that's slated for, months. It can take up to 12 months for a woman to I'm going to say shift to the life changes that a baby brings. It changes the body, it changes the mind. On just the human level, you now shift from thinking about your body and keeping your body alive and well to thinking about another human being. That period is just not long enough. We're asking moms to go back to work like weeks after they give birth. So one of the pieces of legislation that's up in the city, up in the state, I should say, is to increase coverage from 2 months after birth to 12 months after birth. Just providing that comfort. Now, if we look at this from like a global perspective, and we talk a lot on the show about that cultural competency, how we do things, like what's built into our nature. Have y'all ever noticed? And I thought about this as I was working on a script. You can go into a room full of people, right? And you could hear a bass line from any culture. It could be Indian, it could be Asian, it could be South African, but you hear that bass line, right? Your body instinctively starts to move, right? There are some things culturally that we have. In that same vein, I feel like when a new baby is brought into the family, they get shared with love, right? Like we do a baby shower for them, right? We schedule time to go see the baby, right? We want to make sure that this child is welcomed into our community. But then it's like, okay, mom, now we got to make this money. You got 2 weeks to kiss on your baby and then go back to work. What about the emotional connection, right? That needs to be made with that kid. That's a cultural connection. But we give people 2 months to do that. Now let's think about this. If we said weddings, right? We all been to weddings, right? And one of the things is like after the wedding, you go the honeymoon, take some time, you start to build your marriage, start to build your relationship. Imagine if you said you got 30 minutes and then you're back. Go over there, kiss, hug, do all that, and then come on back. We got work to do. We wouldn't take that because culturally, we've said that you got to have we even call it the honeymoon phase, right? So why do we in our health do the opposite? People are going back to work after surgery like a week later because the benefits run out. We have the opportunity to change that. So call your legislators. When she shared that information that coverage is 2 months, 8 weeks, somebody calculate the hours for me, right? We wouldn't do that in any other life change. Why do we do it for new moms? And especially in the climate where we say we care about life, right? And we want to support babies and we want to support healthy communities. Now is the time to put up. So that was one of the pieces that I thought was really interesting. Outreach, as you know, is a federally qualified health center. And so the allocation that's coming up for children and moms, for diapers, for home visits, all of that is up for grabs in this new budget. And I've just decided that for the next quarter, I'm just not even going to get upset about executive orders. I got to restore my personal peace, right? I'm not even going there. But that doesn't mean you can't. So you can give me a call at 414-444-5250. Share with me what your thoughts are on just how the health is related to the legislation, cutting Medicaid. Last show, or maybe a couple shows ago, we talked about Meals on Wheels, right? Y'all remember I brought that up? They're cutting off Meals on Wheels. What kind of community are we cutting seniors off of Meals on Wheels? Like, I don't even care about you balling out at this point. Grandma's not eating, right? We got to do better.
That is just when you speak to that, you're speaking to federal dollars.
Yeah.
Is there anything that the state can do that doesn't require federal dollars to be able to do that?
And that's the issue that we have. So Senator Johnson put together just how much allocation that we get from the federal. Mm-hmm. So most of our programs are funded at the federal level, right? And that's almost to alleviate issues that might occur by state. So let me give you an example. In Mississippi, there's a couple statistics where we are neck and neck with Mississippi. Now, when you think Mississippi, you think they're probably the lowest in education, right? They're marked as the most unhealthy in the nation. And that funding, we wouldn't want to be Wisconsin's funding, right? You take a state like Delaware, and I'm just going to use Delaware as an example, is really considered one of the most wealthy places. So if you had to make them equal, you would all have to spend the same amount, right? So that means either the folks in Delaware get sicker, get less educated if you spent the same amount, right? So we do want a federal solution because the federal money doesn't matter where you are, right? So that's why I say we got to be careful with the state piece, because there's nothing Mississippi is going to do that's going to make them New York, right?
Right.
Like the funding isn't there. So we need the money. So Wisconsin, to your point, Wisconsin got 55 million allocated to the Healthy Moms, Healthy Babies initiative, which is a part of this postpartum. It brings diapers to the babies. It creates maternal and child health grants, right? It does all of that. So you have that ability. Mm-hmm. 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 Got you. So thank you, caller, for asking for that information. So let me give you that telephone number that you can call again for Outreach Community Health Centers. That is it's on the screen. So make sure you check in on Facebook and YouTube. But it's 414-727-6320. 414-727-6320. And definitely make sure that you call and connect. So thank you for calling and checking in on that, because again, it's going to take all of us. So the 55 million went to Healthy Moms and Healthy Babies, right, for Wisconsin. For lead poisoning, 6.2 million over a 2-year period comes to health departments. Now I'm gonna put a little star by that, because that's 6.2 million divided by how many counties we have in the state. A lot, right? I looked that up during the break. I should know that, but can't keep it all in my brain. So I'll check that out. But that 6.2 is divided up amongst all the different health. I shouldn't even say counties. That's all the individual health departments. So Milwaukee has a health department. Glendale has a health department. Shorewood has a health department. The North Shore has a health department, right? So we're all splitting that pot of money. So even some of the arguments that come out like, oh, we got to reduce taxes. Well, tell me which ones and tell me what they're funding. So the 6.2 is going to lead poisoning prevention. We still need money for testing. And if MPS is showing us anything right now, we need money to make sure that the health centers can test for lead and come up with a treatment plan for those. So that's actual money in the budget. Now, this is where Senator Johnson, she had me scribbling in my notebook, because this I thought was wild. 53203, right? We all know 53206. 53203 is considered the most wealthy in the district, in her district. That's FISERV, right? That's that area. She covers the same 53206, which is the most impoverished in the district. So let me ask you both, how do you feel about like the inequity being so close? So you got the haves and the have-nots. You have the allocation for budget, where I have yet to run over a pothole in the Deer District.
And you won't.
I have yet to hit a pothole in the Deer District.
You won't.
Right? I rarely see anybody panhandling in the Deer District. Right?
And it's strategically set like that.
Yeah. And it doesn't make any sense. So you have the most wealthy in the district, and then you have hi, give me just a second. Greetings. No, you're good. That's our guest coming to join us shortly, and I'll share a bit about him. But then you got the 53206, which is considered the most impoverished. So you have the potholes, you have the panhandlers, you have the access to health, you have or the limited access to health. And you have some of those disparities that come into play that just show how different our community is. So I'm interested to hear your thoughts on that. In the same coverage area, you have the haves and the have-nots. So 414-444-5250 is the number. Health disparities. Now, on this show, in the thoughts of building this show, in the thoughts of what kind of information our community needs, we looked at 5 target areas. The target areas are mental health, violence, drug use and overdose, alcohol, and access to healthcare. So when you look at the topics that we talk about on the show, we try to make sure that they all kind of wrap around that. That's what our community needs most. We need resources for mental health, because listen, if we're real honest about it, and I like to think we all could benefit from therapy, just kind of talking through it. We could all benefit from more reflection, slowing down, thinking about what we're doing and how that's impacting others. That would be a benefit. But again, I say culturally, I feel like we do that. Listen, the barbershop, right? Gentlemen, y'all know the barbershop, right? And I recently have stopped going to the beauty salon, and I go to the barbershop to get faded up. Shout out to my barber Chris, who keeps me lined up. But that's a place where you had that conversation. Like, what's going on? It's the water cooler, right? What we think about the politics, what do you think about what's happening? How you spending your money? That's like a cultural center for us. But that's not the only mental health resource we need. Like, sometimes we need to talk about the deep things. So mental health is definitely a focus, and we have the professionals for that. She gave some statistics about violence, domestic violence, violence in families, all of that, how that affects the family dynamic. She shared some information on that. So I'm going to plan to put that on our website so you can dig through that and really see what resources you need to take and what resources you can pass on to somebody else. So I definitely will make that a point. Drugs and overdose. I've shared on this show. Debo, I know you shout out our machine, and I always appreciate you. But if you know folks that have substance use issues, they're using cocaine, they're using methamphetamine, the help is right there.
Right.
The help is right there. And one thing I love, our director of behavioral health, she shared, she's like, look, this is about harm reduction. People are going to use drugs. They have since the beginning of time. I mean, if you really, really look at it, people have used some sort of drug, mind altering, since the beginning of time. What we want to make sure is people aren't overdosing, people aren't dying, and they're not getting tainted drugs, right? So I shared kind of in jest a couple shows back that I benefit. Wine is my jam, right? I do the food and wine festivals. I love my glass. It's in my bio. I'm on the hunt for the perfect glass of white wine, right? I'm on the hunt. If I went into a store and didn't know that the bottle I'm purchasing would either make me giggly or kill me, that's a problem, right? So the issue with the harm reduction is like, there's no standard. Like, there's no depot that you can go to make sure you're getting what you think you're getting. So what we're trying to do is fill that gap of test what you're going to use until you get to a place that you're ready to do recovery. Understand that there's an option for overdose. That's real. We even had an issue right here, right, Devo, that we was seeing someone in that state, right?
Mm-hmm.
So the thing I'm saying with this, if you're going to use drugs, use them safely. Get them tested. Make sure you're not reusing syringes. You're not doing the things. Be safe. And that's the gap that we fill. So Outreach Community Health Centers has the machine, but we also have a new workshop. So on Tuesdays, I believe it's from 1:30 to 3:30. You can meet with a behavioral health specialist that can walk you through that substance use contingency management is what we call it. There's some rewards, some things, just better ways to cope. So check out the website, ochc-milw.org, for more information on that. You can check the upcoming events. That's where you'll find that. Additionally, we have the vending machine. Come in, use what you need. Get it? It's all free. Sponsored by Milwaukee County. Get what you need, right? So we got drug use, overdose. The other piece is alcohol. So listen, I often say, I know that I have an addictive personality. If I love that thing, okay, if I love that thing, okay, then that's what it is. But there are some that cannot manage that. And we got to start being real with each other. We got to start being real with others. Not everybody can have a glass of wine. And I respect that. So if there are people in my midst that don't drink, it's never a, why aren't you drinking? Why aren't you? Right? Let people alone. Okay. So the alcohol abuse, we take care of that too. So 414-727-6320 is that number to call. And then the biggest thing that Outreach Community Health Centers does is creates that access to healthcare. For too long, people in our community, and I'm talking to all of us, put off taking care of ourselves for the sake of taking care of somebody else. Let me just say that again. Too often in our community, we put off taking care of ourselves for the sake of helping somebody else, to our detriment. So we have higher blood pressure. We have diabetes because there's not enough time to cook a meal from scratch. I got to go grab something with like 50% of my daily sodium, right? Or I'm holding in the stress of trying to save the world. We provide that preventative care so that you know what? It might be tough to hear you need to have more broccoli in your diet. That's tough to hear because you know what? That burrito tastes much better than broccoli, but that's going to keep your heart healthy. So the preventative care is going to tell you not necessarily what you want to hear, but what you need to hear to live that successful and healthy life, right? So that is our mission, to make sure that we're providing quality access to healthcare. So if you don't have a doctor, you're in between doctors, you got dropped from your insurance, you never had insurance, you didn't pay for the insurance, so it didn't renew. Come on in, 414-727-6320, or check out our website at Outreach Community Health Centers. You can Google that, but make time. So with the last day of Heart Month, I very briefly shared some resources. So I wanted to jump back into that for just a quick second, because what I want you to do is leave this show with resources. So I went to the CDC, and I said, okay, let me help my peeps, my listeners, the world, Milwaukee, the interwebs, YouTube, Facebook. Let me help you with some resources that can actually help. So I want you to go get your phone, and these work on mostly iPhone and Android. I believe there's one that's only iPhone. So I want you to get your phone. Let me give you a minute. Call in and talk back to me, 414-444-5250. But I want to give you time to get your phone, because after tomorrow, I don't want to hear why you're not monitoring your blood pressure. Okay. So the first app I'm going to give you is called Heart and Stroke Helper. Heart and Stroke Helper. So you can download that app, and it'll help you to monitor your blood pressure. There's also Pulse Point Respond. Pulse Point Respond. Okay, so you go to your app store, Google Play, or the Apple Store, and you type in Pulse Point Respond. That's an app that can help you measure your blood pressure. There's also Hello Heart. Hello Heart. So just an application, you can go in, you can track every single day, and then it'll start to give you recommendations on what your heart health is doing. And then the last one is Cardio, and it's spelled QARDIO. So after the show, I'll make sure that all of those links are up on our website so you can access those. But those are in your phone. Now, the other side of my world is marketing, right? So I know how much each demographic spends every day online. That's part of my job. I know which platforms people use. I know how long they use them. And here's what I know. In our community, we use our phones between 3 and 5 hours per day. Let me repeat that. 3 to 5 hours a day. I know that you can take 5 minutes to download an app that's going to keep you healthy and alive. I know because you already on the phone 3 hours a day. So make a commitment to yourself to do better and keep yourself healthy. You are listening to Community Heartbeat presented by Outreach Community Health Centers. Not just a show, this is a movement dedicated to bringing our community together through wellness. I'm Ebony SsALI. It's Heart Month, and we'll be right back. Good morning, Milwaukee. Welcome back to Community Heartbeat, presented by Outreach Community Health Centers. This is not just a show. This is a movement dedicated to bring our community together through wellness, keeping your heart pumping with positivity. Now, you know this show is going to bring you experts. It's going to bring you the knowledge, and it's going to bring it to you in your living room, in your car, on your app, at work. We're going to bring you the knowledge. So this morning, I have Dr. Bill Callowitz in the building. Let me tell you a little bit about Bill Callowitz. He is a family medicine faculty member with MCW's Northside Family Medicine Residency at Outreach Community Health Center. That means he's right in our building. He's right in our building. He grew up in Brookfield, Wisconsin, completed his undergraduate degree at UW-Madison in exercise science, then moved to Albany, New York for medical school, where he gained experience working with New York State Department of Public Health and a local organization providing refugee care and asylum evaluations. He moved to Denver and completed his family medicine residency at the University of Colorado and a fellowship in preventative medicine. Welcome to Community Heartbeat, Dr. Callowitz.
Thanks for having me. I'm a big fan of the show.
How are you? How are you today?
Oh, I'm doing great. Just dropped my daughter off at daycare. She was very sad when I left, though.
Yes.
So
Listen. And she's how old?
11 months.
Okay.
Yeah.
Look, we were talking about babies this morning. We were talking about immunizations.
Mm-hmm.
Did when you took the baby in for the immunizations, I joked that my daughter is she's not a very social, right? She's kind of in her zone. So she's not very outgoing. I took her to get her shots as a kid, and she gave me this look. So I think they administered 2 vaccinations this particular time. So the first one, she looked like, that does not feel good. And the second one, she gave me a look like, Mom, we really got to talk about this.
And then the crying's about to start.
She didn't cry, but she gave me this look like, yeah, whoever this lady is paying. So you took your baby to get the vaccinations, right? So is there, before we jump into heart health and all that, is there any little nudge you might give for new moms who, crazy busy, might want to skip that vaccination?
Yeah, I think truly, like, as far as we talk about newborn healthcare, like, that's probably the most important thing we're talking about is vaccination for preventable diseases, right? And we know these are safe. We've been using them for a long time. There's a lot of misinformation out there. I would encourage them to talk with their doctor. I know the busy schedule can preclude you from getting in, but with these vaccines, you don't need a full visit. You can come in just to get the vaccines. And we try to prioritize that too. And as I told my daughter, I know they're upset when you get it, but I'm like, girl, you're going to appreciate this in the future. You'll thank me later. So
Right. So, I mean, it's a couple moments of the uncomfortableness to make us and keep us healthy. So let me just delve into like your background, how you arrived at Outreach, and kind of what inspired your love for medicine. So you worked or had the experience working with public health in New York. Tell me a little bit about that experience and what are the differences maybe between huge city, New York, right? Which has a population of our state, kind of, right? What are the differences between medicine there and maybe practicing medicine here in Wisconsin?
Yeah, that's a really good question. And I think that's kind of where I fell in love with medicine, is working with the Department of Public Health, like getting to take that step back, bigger picture, realizing in the room with our patients, I can affect one patient at a time, but truly the social determinants of health are really impacting at a higher rate than what I can do at one time. So I really like to balance both of those things. New York is an interesting problem, right? Like the state itself is very interesting because New York City is so immense and has so many people, but the rest of the state, I would say, is kind of similar to Wisconsin. It's very agricultural and spread out. So how do you deal with health problems that affect a major city with also making sure that you're funding rural areas too? I would say the health problems ultimately are kind of the same everywhere. Our health system has huge health disparities among race and socioeconomic status, and that kind of fits across our country. So I would say that what I learned there is definitely applicable to Milwaukee and the state of Wisconsin.
Okay. Now, I put a little star next to the services you provide out there that we're dealing with the refugee population, the asylum evaluation. So just give me an idea of what that care looks like.
Yeah. So I would say there's two separate things that kind of go into this. One is when folks are coming over from whatever country they're going through the like federal process of becoming a U.S. citizen in the refugee process. They come over, they've had an exam done overseas, and then we're doing their intake exam when they come to the U.S. So we go over which country they're coming from, kind of what their travel history looks like, and then diving into their past medical history, which can be quite complex depending on which country they come from. A lot of these folks have never had care before, have never had formal like lab work, vaccinations. And so catching them up on those kind of things and then helping them kind of integrate into our city. And it's something that I love about Milwaukee is that we're really like embracing these folks who are coming, hoping just for a better life. And we're willing to kind of give them that space and some resources to get started. So that's the medical evaluation piece. And then there's also the component of asylum seekers. So those who can't go back to the country they're coming from due to fear of prosecution or, physical or emotional harm going back. And so we do medical and psychological evaluations to kind of help their application in the U.S. court system to say, this person actually did suffer this sort of like problem in their other country, and this is why it would be problematic for them.
So are there, and I guess that's the deep, I'll save that for the second half of the show. Are there some issues that, may have parallels? So I'll say that. It's kind of a loaded question. But when did you discover your love for medicine? So I like to ask that because I think any person that is in their flow, in their thing is operating out of passion. So when did you fall in love with hip hop? That's a line from a popular movie. But when did you fall in love with medicine?
Yeah. And it's funny for me. It was actually after I started medical school, and it was after
so you did all the
medical
tests.
School. Yeah.
And then got it. Okay.
Yeah. I was like, this should be a great career. I didn't have anyone I knew who was a doctor. I, did well on my tests, and folks were like, you should think about it. I was like, this sounds great. But then I realized how much school it was as I started. And then, you hit some ups and downs, but truly it was my rotation with family medicine and the Department of Public Health where I got to see the same people and patients over the course of 3 months. And that humanism component of is what I've really been craving, like meeting those folks where they're at, using my expertise in medicine with their expertise on who they are as a person and combining that with a treatment plan that meets them where they're at. It got me really excited about my future. And with that, working with the Department of Public Health and figuring out how I could mash both of those things together to work on public health and also individual level preventive medicine care.
Man, it's like so then you have the aha moment. You're like, this is where I like to be. And then you're helping to lead the family medicine program at Outreach. So what is it about your passion that you're handing off to kind of that next generation, if you will?
Yeah. And, getting involved in academics and training that next generation of physicians, I think is really important piece of this too. And trying to figure out truly like, how can we leave medicine in a better spot in 20, 30 years than where it is now? And I think helping train doctors in this kind of mindset around social determinants of health, how can we impact our patients more than just the stuffy kind of ivory tower medicine component of it. And what I love about our residency program, and if y'all come to Outreach Clinic, I know some folks are a little nervous about seeing a doctor in training quote, but these are brilliant people. These are physicians. They've completed medical school. What they lack is experience. They have the passion, they have the skills. And so I'm providing oversight for them to kind of shape that experience into the professional piece of it. But truly, you get 2 doctors for the price of 1. So
I'm telling you,
I think it's a great system.
It's almost like a team though, too, because, I will sometimes come in through the entrance and pass by the residents. They're always huddling. They're always kind of talking about what's next and looking at just how to make things better. Right. So you see them kind of putting their heads together. So it's almost like you get a team of doctors, not just the one. So in the training, how long is that training? And maybe what are some of the things that from your experience, you're like, I'm glad they're learning this?
Yeah, good question. So family medicine residency is a 3-year training path.
Okay.
I think each year is kind of different as far as like what they're learning at that point. By the time they finish medical school, their medical knowledge is great. Oftentimes at the end of medical school, that's your medical knowledge is at its peak.
Right.
And then you're learning how to use that into clinical experience. So the first year is kind of like the shock and awe year where we're trying to get them, okay, how do you work within our system? We work at an FQHC sliding scale clinic, you know, that traditionally doesn't get the funding as some of these other clinics. And so how do we work when we're short staffed? How do we work when
the funding is
cut and our patients, you know, and so figuring out the systems is really where they're at their first year. Then we start to move towards clinical application, practice, fine tuning to get them ready to practice independently, which is also a really fun piece of it.
I love so do you kind of see them fly the nest, you know, when they
spread their wings? It's great.
Right.
Yeah.
So we often talk on this show about outreach, having that access to care, having the professionals, having them in their in our community, and knowing that some of those health disparities like heart health, like diabetes, can show up more prevalent than they might in other communities. So since we're talking about heart, what are you kind of seeing, just generally speaking, as patients are coming in presenting in the clinic? Do you see heart and hypertension up overall, or do you think it's people are finding the healthy path? What would you say?
Yeah, I would say in general, we have, I would say, two different styles, but a lot of times and most of the patients we're seeing are folks who haven't seen a doctor in over 10 years. And we're so happy when we get these people into the clinic, and we're like, these are the folks I think we can make the biggest change for your health and improve your health outcomes. And those are the folks who may have had high blood pressure for 10 years and not known it. Those are the ones who might have like pre-diabetes or starting to become diabetic. But the thing about those diseases, as you know, is that they're silent. You have no idea you have those things until you get screened for them. So I would say those are the folks that we're catching that more in. And then we have the people who are there every 6 months.
Right.
They're on top of it. They're telling me what they ate for breakfast and lunch the last week. Like so it is kind of funny to have those.
You get both. You get both. You talked a lot about the silent piece. So knowing that hypertension, knowing that diabetes can pop up in that way. One of the things that always strikes me when I'm thinking about what could happen is like heart disease in women is like the silent killer, right? So you might have a little pain, but we're like, I get a lot of pain every now and then, or you might have the headaches or the jaw tightening, or so what are maybe some of the things in women of a certain age that might be those tells, if you will, that there's something going on with the heart?
Yeah, and you bring up a really great point. What we rely on, where you'll see on the billboards about a heart attack, is all based on studies 40 years ago on white men. And that is not how people usually present, with the crushing chest pain where you're holding your chest after exercise. It's truly not how most people will present with it. What I've seen in my experience is a broad range of symptoms. And I say this not to frighten folks, but to more just like educate y'all, right? Like upper abdominal pain sometimes, numbness in your arm, bad headaches.
Let me write this down. Okay. This is good info.
Dizziness, like feeling like your heart's beating abnormal. And so truly what I would recommend based on that, and again, I'm not saying if you have any symptom like I'm having a heart attack, but after the age of really 45 for women, you should be screened regularly for diabetes and cholesterol, is what the USPSTF recommends. And so I'd recommend, even if you are not having those symptoms and you're around that age, come on in and get screened for it to kind of help triage that better.
I like that, like just in case. So when we think of like maybe some of those other diseases that can sneak up on us, we talked just very briefly during the break about cancer presenting, right? So if we're looking at pain in the abdomen, how does that maybe tip you off that something else might be going on?
Yeah, I think the body works as a whole, right? So like one symptom that may not be related could be the sign that you don't have the reserve you used to have, and there's something off elsewhere. And like your abdominal pain may just be due to a simple thing like acid reflux.
Yeah.
But if you
got a little gas,
if you,
know?
yeah, right, you could be a little constipated. You could have
Right.
had something bad to eat the other day.
Right.
But also, you come in, you're at an age where, we realize you're actually overdue for colon cancer screening.
Yeah.
Or you're
Yeah.
overdue for your mammogram.
Yeah.
We get those things rolling for you, and that's oftentimes where we'll actually catch some of these things. And so I think it's important to regularly see doctor, even if you're feeling well.
Just make the appointment,
Mhm.
get in, get checked out, and then get on that regular schedule. So you can make an appointment, 414-727-6320. You can schedule that for when it's convenient. You said you have appointments next week. So again, no excuses, y'all. Get up and
There's
let's
no 3-month wait. We can get you in next week, I promise.
Right. So and then you have the dental piece, right? So there is a connection between, and I know it's still in research and we're still digging into it, but there's a connection between our oral health, our dentistry, and our heart, right? Like there is a loose connection with how we're taking care of our teeth and then how that plays a role in our heart. Any light you can shed on that?
Yeah, I think I'm not a dentist, but I do always ask my patients at every annual exam, are you brushing your teeth? Are you flossing? Because there is that connection between heart health and oral health care. And I think it's something that we often miss. And that inflammation, basically the process of inflammation in the gums, bacteria buildup, is bad for your immune system, which overall is bad for all sorts of other medical conditions too.
And I only set that up because I know we have a dental clinic, right? So I'm like, you just
love you.
Right. You get in and you get everything checked. So you have your annual, or if you have some of those other conditions, you're going to be in a little more regularly. But then your dental clinic is right there. So my mind immediately went when you said you don't have to wait 3 months, because dental care is also a bear to try to get into. I've had my dentist say, or hygienist say, we can get you in, but it's going to be like almost 13 months. Whoo, lady, I need my tea. I drink coffee every day. I got my wine going on. I need to keep my pearly whites white. So I know that there is a connection between that. So outreach community health centers can help you just knock out both. You can get the dental piece done and you can get your heart and that wellness check. So when we get into heart disease, right? I did a little bit of homework. I didn't write my thesis on it, but we've got coronary artery disease, coronary heart disease. Give me an idea. What are those?
Yeah. And how I like to think about those things is that those are like downstream effects of other problems that you'll commonly hear. So high blood pressure, hypertension, bad cholesterol, those are things that over time will damage the blood vessels leading to the heart. And so the end stage of those two diseases will be damaged blood vessels, which then lead to decreased blood flow to the heart. And that's how you present with massive heart attack or stroke. And so I like to think about it as not an individual disease, but a downstream effect of things that we can treat and prevent.
Oh, the other things. Okay, that makes sense. Now tell me, with cholesterol, because I grew up in a time when commercials told us everything we needed to know about life. So what I know is that eggs and cholesterol are connected. That's what I know from the commercials. So give me an idea of how diet, and are there some no foods for cholesterol, and like what should I be doing with that?
Yeah, and I think there's a lot, and in the nutrition sector online, there's all sorts of things and supplements they should tell you should be taking, and truly I try to keep it really simple. And there's a book I like that has the phrase "eat food, not too much, mostly plants." And I think if you follow
what book is this? You put us in the book club.
It's called The Carnivore's Dilemma by Michael Pollan.
The Carnivore's Dilemma. Okay, I'll put a link to that on the site. Okay.
And it's an interesting framework around like what you talk about with eggs is, yes, eggs have cholesterol, but not all cholesterol is bad. And eggs are such a healthy food in general with good protein content, not super high in carbs. And so that's not one that I'm actually most concerned about.
Okay, what concerns you? Then? What concerns you?
Trans fats in our diet in the US is probably the biggest thing that's different than most other countries is we have a lot of processed food. And so I tend to think about processed food. If you know all the chips you get, the deep fried food, the frozen
the delicious
stuff,
food.
That's really,
it's
delicious. Don't get me wrong. Yeah. But
not good.
But oils can actually be really helpful. Things like
look, I'm writing
avocados, things like olive oil, You mentioned eggs, fruits and vegetables, all of those things, which kind of, if you need a quick and dirty template to follow, the Mediterranean diet is a really good kind of piece to look at. And so not all fats are the same. Fats can be really healthy and actually
I like
for
the
you.
fats.
Yeah. Listen, I live
that.
close to Kopp's custard, and that's not a healthy one.
I love it.
Yeah,
love it. But custard doesn't count because we're in Wisconsin.
Exactly.
So it totally doesn't count. So looking at the lifestyle, the diet, I know I pulled down some numbers on exercise, but in this day and time where we're hustling back and forth, sometimes we can only do a little bit. So if I can only do a little bit of exercise, what's your recommendation?
This is one of my favorite questions in clinic. So I was an exercise science major
for
my undergrad.
Yes.
And truly, I think this is one of the biggest small changes you can make for your health, and what I like talking with patients about. And the folks I like talking about this with most are the ones who are not doing any formal exercise.
Right, because right now I'm doing the walk from my car to the house, and then
yeah. And what I would say is that for a positive is this is something that a small amount of change is going to make a big difference in your and these folks' health. And you don't have to go to the gym 5 days a week to meet the exercise recommendations. That's not realistic for most people.
I wish I could drop my body off and then just pick it back up. Okay, so I can't do that. So how little can I get away with?
So the recommendations and over a week is 150 minutes a week of exercise. That's 30 minutes a day for 5 days a week. I'm not when I talk with folks about this, I don't expect you to go from 0 to that immediately. That's not realistic or sustainable. What I want you to think about is, okay, how can I work in 5 minutes once a day? Am I going for a longer walk? Am I taking the stairs, an extra time or two? Am I doing some free weight exercises while I'm watching TV at night during commercials?
I suppose I could do that. Right.
And then you do that for a week. Yeah. Next week, I want you to do that twice a day. And then over time, next thing you know, you're doing that 15 minutes a day and you're meeting guidelines. So
I might just be too fine for the summertime. I don't know. Just
you got time. It's February still,
right? Right. So we got the lifestyle lockdown. We got the preventative care. So we're getting checked out. We know a little bit more about what we can do to keep our hearts healthy. When you look at the patients that are coming into outreach, maybe even those that are looked at in that social determinants of health, so they have the maybe the alcohol, the substance abuse, the hypertension, and this is the first time they've been in a health center in the last 10, 15 years. What are some of the conditions that you treat most at outreach that we can kind of say, this is something our community needs to look at?
Yeah. And I would say, in those cases too, I like to frame the conversation with patients. Rome wasn't built in a day. We can't fix everything right now. I'm so glad you're here, but this is going to be regular visits within what works with your schedule for a few months till we get everything under control. So I like to frame that first. I like to start from the bottom up. If you have social issues with transportation and housing, that's preceding any other health problems.
It's hard to take the vitamins, right? When you don't know how you're going to
get your meds, how do you get in for your visits? So we like to focus on that area first. And then from so we deal with, all sorts of social determinants of health from a non-medical standpoint. From the medical standpoint, what we treat most often, substance use disorders, alcohol, tobacco, recreational drug use, that kind of issues. We also deal with high blood pressure, diabetes, truly any of those chronic diseases. Stress is another piece of this, mental health. I would say those are the most common things we're dealing with.
Yeah. What you got, Devo? You got a question for us?
I have a question from our viewers.
Okay.
One of the viewers. And I don't know if this is, posed as a question or if it's factual, but she simply said, "Good morning. Menopausal women have a higher risk of heart attacks if they are not receiving HRT." Now, I don't know what HRT is.
Yeah, that's an interesting conversation that the data on this has actually switched a lot over the years. So going through menopause, HRT stands for hormone replacement therapy.
Talk to us about it, doctor. Talk to us about it.
And I'll frame this with, I'm not an expert in menopause. My patient panel tends to, as a man, I get more like young men and middle-aged men, and then older women for whatever reason.
I mean, it's the baby phase. I gotta tell you guys.
So. But so during menopause, your estrogen levels are dropping. And so
Okay.
50
Okay.
years ago, they started putting folks on estrogen therapy to replace this due to the symptoms that they were experiencing. What we found initially was that increased risk of heart attack and stroke. So we stopped it for many years.
Okay.
About maybe 15, 20 years ago, we looked harder into the research on this. And we found that actually for most patients, it was not an increased risk of heart attack and stroke and may actually be protective. Where we're landing at now is that it's kind of an individualized case. It depends on the patient.
Okay.
If you are going through menopause or experiencing menopause, you should talk to your doctor about it because it truly depends on your risk factors,
Family
family history,
history.
your
Okay.
medications, all of those things before you make that decision.
Okay. Okay. No, that makes total sense. See, we got Dr. Calloway in the building today. When we come back from break, he'll give us a couple more tips that we can do. But listen, you can make an appointment with Dr. Calloway or the entire residency team at 414-727-6320. You are listening to Community Heartbeat presented by Outreach Community Health Centers. I'm Ebony SsALI in the studio with Dr. Bill Calloway. We will be right back. Welcome back to Community Heartbeat, presented by Outreach Community Health Centers. Not just a show, this is a movement. Today, this movement is taking us into heart health. We've got Dr. Bill Calloway in the studio, family medicine resident faculty. So he's the trainer of the doctors, right? Now, I love what you said. These are full physicians. They've been to med school. They're learning that clinical piece, that interaction. So I love that. So they're better equipped to assist in Milwaukee. I've always shared on this show, I want to keep them forever. Milwaukee has a very strong legacy piece.
Question.
Okay, what you got?
I guess it's my question, actually.
Okay. I knew he would have
when
one.
you say residents, do doctors, if you will, come out of medical school with a great disposition and or bedside manner, or is that a part of the residency program?
Yeah, tell us what actually is residency.
Capitalize on that bedside manner.
Yeah, I would say it depends on the resident. And I would say in family medicine in general, if you're choosing that as a specialty, usually you're pretty good with people, or you should be. That's our specialty, right?
Okay.
Like the humanism piece, like I mentioned before, is an essential piece to what we do in primary care.
Okay.
I would say most of the residents are there with excellent bedside manners, and we're teaching them the clinical piece.
Yep.
Sometimes,
the systems,
though,
the process.
yeah. And as you learn that system and you're like, I have 15 minutes for a visit, and you might lose that humanism piece. And that's what I try to do with my education of them, is like, that's the most important part of what we're doing. And you got to keep that regardless. And, some residents need a little extra care on, especially dealing with like marginalized populations, substance use disorder, those who have been incarcerated, refugee patients, that kind of stuff. They might need a little extra guidance on bedside manner with those populations, and how to, be, kind with your words while also managing their health problems. So, but overall in family medicine, your doctor should be a very personal person. And we find that at our program.
Now, with that being said, Doc, one last part, and then I'm going to leave you be.
This is good.
Have you personally ran into a situation where, you and I know you shouldn't, but I guess you develop a concern, an overall genuine concern for particular patients, what have you, folks you may get close to for whatever reason or another, and they just won't do what you're telling them they need to do? Have you ever had to like restrain yourself from just going completely off, saying, what the hell's wrong with you? I'm telling you need to do this, and why aren't you working with me here? How does that work? And have you ever had to like go there?
Yeah, I mean, absolutely. And I think some folks will tell you that really burns them out and gets them frustrated with their work. But I'll say my job is to provide you with the information, and you're a grown adult. You make your own decisions. If especially I treat substance use disorder a lot, and like that's not a linear journey.
Right.
It's up and down.
Right.
And so I think earlier in my training, I found myself getting more frustrated when folks weren't following the directions. But through my training, and I had great mentors and in my experience, it's truly, I want to meet you where you're at. You're never going to disappoint me. I'm here for you, and I want to help you along this journey, however much you want to participate. And I'll give you the information. I'll lay it out for you to use how you will. And truly, if you don't do it for a year and you come back, I'm going to be excited to see you again in a year and work on it again.
Because it's another opportunity to start. I like that. I think too, they're different kinds of professionals, right? So if I think of myself and my husband, we are totally different in our approach. I can see him as a physician. He wants to get in, figure out what's wrong with you, and put you on the path. He's like, he doesn't need to smile at you. Like, we're here to figure out what's wrong. So his approach might be a little different. He's like, what are your symptoms? 1, 2, 3, 4. How long have you had symptoms? 1, 2, 3, 4. Excellent. You have this condition. This is the process. Toodles. Right? So I think they're different kinds of doctors, and different competency. So I think you need both, though.
Totally.
Because sometimes you need a person to say, look, I'm not playing with you. If you keep on this path, you will die. Like you need to make some changes immediately. So I think there's space for both of them. So you'll get the love and the care, but stern when it needs to be.
Oh yeah. And I think you have to balance the carrot and the stick, as you're describing. But you truly have to have those hard conversations sometimes. And once you lay that information out, truly the patient's the one who, like, if you don't want to make the change internally, nothing I say is going to make that change happen.
You're right about that. You are right about that. So let me ask, just kind of in the reflection piece, as faculty, working with these doctors that are moving out into the community, what's one thing that you have learned? So you're in the teaching side.
Yeah.
What is one thing that you've learned?
Yeah. Especially with this program, I would say at the Northside Family Medicine residency, our residents come from very diverse backgrounds and experiences. We have residents who have trained all over the world, who come from very different, socioeconomic statuses, from different cultures, and combining all of their different views to medicine and that cultural piece is a really important part of the care that we're providing. So, for instance, like you were just mentioning, in other countries, it's not like in the US, it's kind of like the patient is is the customer and whatever they say goes. And then in some other countries, it's like, nope, this is what you're doing. It's very paternalistic. And like you mentioned, finding that balance of how can we do risk reduction with balancing those two things, I would say is the most interesting thing I've learned thus far here.
And I mean, they are so diverse. I just think, but the one thread that binds you all is the passion for medicine. So I always lead with the, when did your love for medicine start? And like immediately you're like, well, let me tell you first I did, so that part warms my heart, warms my soul. So I love to hear that you're taking away positive things from this. Now, you will be the man of the hour on March 19th.
One of them.
One of the men of the hour. We talked at the top of the show that we have Dine with Docs 2025. It'll be at Benihana's on Wednesday, March 19th. You're one of the physicians that'll be cooking. Do I have that right?
Yes, you do.
I do. Okay. Yeah. So do you have any experience with this, or are we learning together?
So I like to think I'm a pretty good chef. We'll see what my baby eats everything I cook for her, so that's a good example. I have never made hibachi before.
Babies don't know any better.
Hey, she doesn't know yet.
She laughs at my jokes. She thinks I'm funny. Yeah, she doesn't talk back. But I mean, you'll have to come and find out for yourself, and then give your feedback on how I did.
What's your best dish?
So that's a great question. Stir fry is probably what I do most frequently.
Okay.
And I like that because you can just mix and match all sorts of different vegetables vegetables. You got your complex grains, maybe a little too much soy sauce sometimes. But,
what protein do you like to cook with?
Yeah, I probably use chicken the most. But eggs, I use a lot of eggs, and that's why when you were like bad cholesterol,
you're like not in the eggs.
Yeah, I eat them all the time. Probably chicken the most, but a little bit of everything.
Okay. So if you are at Dine with Docs, which I know you'll be there because you got to get your tickets available on the website, you're there. Make sure you stop by Dr. Calaort's table, get a little sample of his chicken fried rice, and then just weigh in. Now, the doctors are actually judged, and there is a prize. So, I mean, bring your A game. No. You put doctors in the room and they start competing. we want winners here. So no, I'm excited about that. I am continue to be excited about what Outreach is doing, the partnership, the collaboration. And like I say, the work for me is driven by a healthier community. So we talked briefly during the break. 10 years from now, what would you like medicine to look like in the city?
Yeah, that's a really good question.
What would you like it to look like?
My dream is a much more diverse workforce that reflects the community we live in.
Okay.
And health outcomes that more match health equity in what we're shooting for. So I want us to shift the focus away from having to catch people who have stage 3 cancer. And I want to be catching these before they even happen. I want our communities to be thriving, healthy, and having the resources they need to live a healthy life.
That preventative care, kind of making sure that we're looking at things before they become a big issue. So I thank you for being here today. This was fun. You shared some serious knowledge with us as we close out Heart Health. What's one thing, if I look at all this, I go diet, I go exercise, I go stress, I go, mental health. What's the one thing I can do for my heart? If I can only do one thing to take care of, maybe reduce that hypertension. I know exercise science
Yeah.
is your thing.
Yeah. So my heart wants to say, pun intended, exercise, but truly
Okay.
I'll start with stress reduction, right?
Okay.
And for everyone that's different. You need to look at your life and say, what is preventing me from being the healthier person I want to be?
Yeah.
Is that stress around my job? Is that stress around my family situation, social situation? And then think about how you can take steps to work on that stress reduction. It's not an easy thing to assess either. So that's why I'll go, if I got to pick one thing, I'll choose that.
See, so I shared on the show, my stress reduction technique is just saying no and being okay that I don't have to save the world. That's like half of the battle, because I think a lot of times we take stuff on and the world's gonna crumble if I don't do. No, the world will be fine. It's been here. Debo will be all right if I don't do everything I'm supposed to do when I'm supposed to do. So I thank you for the tips you've shared, quality knowledge that you shared with us today. So our next show, Community Heartbeat, will be on Friday, March 13th. Now, would you consider yourself a nerd, Dr. Calloway?
On the screen.
The 14th. Yeah. Friday, the 14th.
13th. Now, is it
Did I?
Is it the 14th or the 13th?
I'm going to tell you why I know I said the 14th. Watch where I'm going. My nerds lean closer to the radio.
It's Pi Day.
It's Pi Day.
Yeah.
Are you a nerd?
Absolutely.
Okay. Do you know about Pi Day? Okay. So 3.1415 is pi. So is pi okay for my heart? What kind of pie can I eat?
You know what? Everything in moderation, whatever pie your heart desires.
Now, is moderation one pie? Is moderation
no
moderation
is
I'm going to plead the fifth on that one.
Moderation is a slice, Ebony.
Right.
On Pi Day, you get the green light.
Oh, okay.
Yeah.
So on Pi Day, you can wild out. That's our next show, 3.1415. So that's March 14th, 7 a.m. We will be right back here. March is nutrition month, so we'll be talking about healthier diets, healthier foods, but it's also Patient Safety Awareness Week. Look, I have to read it. Patient Safety Awareness Week. So when patients come in to outreach, not only do we want to provide care, but we want to make sure that your environment that you're getting at outreach is safe. So we'll talk about what that looks like internally. I think we have another resident coming on that show. Don't know which doctor yet, but I do believe that. So maybe we'll have pie. I got to figure that out. From a marketing standpoint, I'll figure out a partnership, a collaboration. So remember, get your tickets for almost said Community Heartbeat. Get your tickets for Dine with Docs so you can meet Dr. Calloway. He'll come in and he'll be cooking and serving us some good food. And make sure you're there for the community.
Are they cooking in scrubs or?
They have custom aprons and chef hats.
Yeah.
Right.
Geez.
If you play,
is Don gonna be there?
If you play your cards right, Don might be here with his chef's coat and his hat next time. We'll see if you play your cards.
We'll be
right.
nice.
We'll see. So make sure you follow us on all your social platforms, Community Heartbeat Radio Show. And make sure you stay tuned on Pi Day. Join us back here. You are listening to Community Heartbeat presented by Outreach Community Health Centers, not just a show. This is a movement dedicated to bringing our community together through wellness, keeping your heart pumping with positivity. Every single month, we are here to bring you information connecting our health, wellness programming, upcoming events, health screenings, all of that. So thank you, Milwaukee, for sharing time with us. I'm Ebony SsALI. Thank you, Dr. Bill Calloway, for being here today. We will see you soon. Have a great day.